Welcome to Your Care, Your Choice, a podcast by Community Nurse. Over the past 100 years, we have prided ourselves on continually evolving and developing new and exciting initiatives to better serve you and your families. This podcast is one of our more recent examples. I am your host, Dr. Todd Hayes, physical therapist, and today we're going to talk about a topic that is near and dear to my heart, hospice. Many people will never get to utilize hospice services, and most do not understand what it is. We hope by the time we end this episode, we will all have a better understanding of what hospice is all about, and we will definitely have a better appreciation of how beneficial this program can be. Hospice is relatively new in our culture. In 1963, the Dame Cicely Sanders from the UK gave a lecture at Yale University on specialized care for hospice. 11 years later, the first hospice in the United States was created in Branford, Connecticut. 9 years after that, in 1982, Congress passed a bill to add a hospice benefit to Medicare insurance. Private insurances soon followed suit, and another 11 years after that, the hospice benefit was codified nationwide in the Balanced Budget Act of 1993. So hospice in this country is really only about 30 years old, and it's not a well-understood program. And because of this, there are many myths, misunderstandings, and misgivings regarding this excellent program. Some of the challenges people face when enrolling in a hospice program include a person's own belief system, as well as that of their families and their doctor. Also, for those who are not dealing with cancer, a 6-month prognosis is hard to nail down. But I'm getting a little ahead of myself. So before we go any further, let me introduce you to our guest for this episode, Erin Vanderveer. She's a nurse practitioner with Community Nurse and one of the cornerstones of our Hospice and Palliative programs. Welcome, Erin.
Thank you so much for having me today.
Thanks for coming. It's always great to have someone in to talk to us about our topics. So please explain to us in a general sense, what is hospice?
So hospice is a defined benefit through Medicare where the person has decided they wanted to focus on quality of life and not pursue curative treatments. So basically, they want to stay home and be cared for at home by their family.
That's nice. Mm-hmm. So what does that really entail? What kind of services do we offer with that?
So hospice is like a team approach. There's many different services and support for families that are caring for someone who is at end of life. We start with our team of people, which is you have a nurse who can come out to visit, usually once a week, sometimes more, depending on what's going on. There's a home health aide who comes out and helps do personal care for your loved one. And they're there about an hour a day and can come almost daily. There's also a social worker who helps with both emotional support and also finding like community resources for the family and patient. And we have a chaplain as well who helps give spiritual support, and volunteers. And our volunteers are amazing. They don't do personal care, but they can come out, they can play cards, they can, whatever your hobbies are, kind of participate in them. We have, at Community Nurse, we have a death doula, and sometimes we have volunteers who come and they sit vigil for patients when they're at the very end of life. And we'll actually like sit by a patient and pray with them for like however long is needed. So that's kind of like the team people. And then there's much more support in terms of like any medical equipment that you would need that's provided. There's like hospital beds or pretty much anything that a person would need, we're able to provide for a patient. So oxygen or like recliner chair, just many different things, tables, shower chairs. And then there's all the supplies that you would need. So like chucks and briefs and things you don't even think about, those are provided. And then the last part would be like medication. So basically they any medications that you're taking that are related to why you go on hospice is provided and delivered to your door, and then nurse just like calls and does the refill, so you don't have to like call CVS and worry about doing all the, refills of your medication and things like that. So it's really, hospice is really what we hope all healthcare would be, where you look at a patient and a family and you get to wrap around all the supportive care to help care for that person at that time. So.
And that's really individualized, right?
Yes,
And based on
absolutely.
what the family and the patient need and request.
Absolutely. So that all is available to you. You don't have to have the whole team if you don't want. So some people come out and they just have the nurse come out. But yep, absolutely individualized.
Now that sounds kind of expensive. How does a patient pay for that?
Yeah, it does sound expensive, but this is a defined benefit in health in Medicare. So that there's no cost. You've already paid for Medicare insurance, so there's no extra cost or anything like that.
So the equipment, the counseling, the nursing care, the home health aid,
right?
That's
no
all
bill.
part of the package.
Correct. Mm-hmm.
So that's nice. It doesn't leave the family with a big burden.
No, exactly. Mm-hmm.
So how do you qualify for hospice services?
So it is possibly different with different insurances. So you should check with either a social worker or shine counselor or talk to your insurance just to make sure that you have the hospice benefit. But under Medicare, the eligibility is that your physician has to say that it's possible in 6 months that you could pass away. It's not definitive. And we do have some prognosis tools that kind of help with kind of guesstimating, you could say, if it is possible. And then also that you've been declining. So whether it's you've been losing weight or you're functionally declining, where you used to be able to walk well, now you're using a walker or a wheelchair, or used to be able to eat on your own and now you need assistance. So you have to kind of have both of those entities at the same time.
And well, what happens after 6 months if you haven't passed on, or maybe you've gotten better? Or?
Yep. So at actually even before 6 months. So in the beginning it's 90 days and then it goes to every 60 days. It's a recertification period, and you basically we kind of check and see how things have been going. And you have either a nurse practitioner or a physician come out and visit with you as well to see, like, they go over kind of what's been going on with the nurse and how you've been feeling and reassess and see how you're doing. If you are continuing to decline even just a little bit, you continue to stay on hospice. And that could even just be like you lost a little bit of weight, or you're a little more short of breath and you need more oxygen now, or something like that. If at that point they find, or even before that point, they find that you're actually improving, sometimes when you get all this extra care and support, you start improving. And we call it graduate. And so you say you graduate from hospice and you come off of your hospice benefit. And then down the road, whether it's 6 months or a year from now, like, you can come back on if you qualify.
So after you go through all this trouble of getting your family on board, getting the doctor on board, which can sometimes be challenging, right? The physicians, the hospice model is a little bit antithetical to what we're normally promoting in healthcare, which is better, 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 fight, 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 right? It's hard sometimes to get the medical professionals on board. But we've convinced myself, we've convinced my family, we sign up, and I changed my mind. Can we do that? Or
Yes, absolutely. You can revoke your benefit at any time.
is there a penalty for that? Or?
Nope, no penalty.
No. So I'm not stuck on hospice.
No,
now,
absolutely not.
Going down this hill with no ability to choose or change my mind.
Nope. Ideally, you go on hospice with the idea that you agree with that philosophy, that you prefer to be at home and focus on quality of life. But at any point, if you decide, you know what, Mom, I think you really need to go into the hospital at this point, you can always revoke your benefit and go to the hospital or do whatever you needed to do.
I think sometimes people really struggle with the choice because it feels like you're giving up hope, or you're not trying hard enough. You know, in our culture, it's really emphasized and rewarded to fight the good fight and never give up. But I did hear it put once that when you have a terminal illness, sometimes the way you can take control and have more choice is by choosing to go out and with dignity and surrounded by your family and your loved ones, instead of waiting for chance to put you in an ICU or a hospital where then you really don't have much say as to what's going on.
Right.
Hospice is a big deal to me. It was a big deal in my family. My mother, at the end of her career, was a hospice nurse. And part of the reason I even got into home care was the way she explained it to me. Was in all the years she had worked in healthcare, it was the most patient-centered care she had ever seen delivered. So she had been a hospice nurse for a while and then was diagnosed with pancreatic cancer. And we had to bring her home under hospice. And one of the prevailing messages from her was she wanted to get home and be cared for there. She didn't like the institutionality of the hospital. It felt too impersonal. And she knew what was available and how that situation could go. And it was so impactful on our family. One of the things that I think people sometimes misunderstand is they think that hospice is just about the one person, the patient. But it really truly is a holistic way of treating people. And as you said earlier, maybe the way that care should be all the time. Patient-centered, involving the whole group. We had the chaplain services, and the social worker came and helped, and helped my brother and I through the process. And in the end, especially when I'm talking to other people about loss that they've experienced, it was a beautiful experience for us. I like to tell people all the time that, when you go to a city you don't understand, you like to have a tour guide, right? So we're all going to pass on, and we only get one shot at it. So we're rookies. So it's really important to have people like you that can kind of hold our hand through the process and help make it less scary and less traumatic and less awful, really, when you have the opportunity.
Yeah, we have excellent guides, I would say you're describing, that can kind of help people through the process and let them know what's coming in the future and better prepare them for what the next steps might look like or sound like, and just give them a place where they feel supported going through it.
It can be really scary, right? Because you don't know
Extremely.
what's going to happen next. And for many, nobody wants to talk about it. And again, I mean, maybe that was part of the trauma that we experienced. I lost my mom when I was under 30. So it was really, really impactful. But it shocks me that no one wants to talk about this thing that is guaranteed to happen.
Yeah,
There is
happens to
no
everyone.
way around it.
Yeah.
And when you try to bring it up to parents, or in fact, they just, no, we don't want to talk about it. Don't bring that up. We'll talk about that later. And then when it comes up, if you don't have a plan, things can go sideways really quickly. We did an episode a few episodes ago about what did we call them? Fundamental documents, right? We had a lawyer from Supernaut and Beniski come in and talk to us about getting your end of life documents together, your will and the living will and the proxies and things. And those conversations can be too much for people. So it's really great that we have a team that will swoop in and really try to address the family's concerns on all levels.
And I mean, sometimes I think families think their loved one doesn't want to talk about it. And I go in and I start talking to families, and the patient just opens up about all the things that they wanted to have happen. So they'll tell me, well, I already have my plot picked out and I want to wear this outfit. And so they've already been thinking about it. And I think that families don't necessarily feel comfortable to talk to their parents or wife or spouse or kids about what their wishes are. And hospice as a team kind of helps both kind of the communication between a patient and their family, figure out what the, you know, what the plan is. So often patients get to take back their power and their control, because in a process where you're completely out of control, we don't know how anyone's going to pass away or exactly what symptoms they're going to have. But if they could control things like what they're going to wear at their after they pass, or what music is going to be played, that gives them more sense of control back, and they feel like empowered by the process, I think, what I've seen.
Now, you mentioned the medications earlier, and one of the things people misunderstand is that when they come on hospice care, it doesn't mean all aspects of your care are halted. But in our experience, the other thing I thought was neat was there was much more of a focus on the comfort. So we had pain medicines and anxiety medicines for my mom. I could have used a little bit of the anxiety medication, I think, at the time. And since my daughter became a teenager. But, that was something that opened my eyes. I thought it was so wonderful. And, here we could see, mom's getting really worked up, really stressed out. Here, do you want to try this or do this? And these were not things that just snowed her under or by any means, but
Right.
it allowed us all to kind of ease through when things got a little intense or a little painful, or and it's interesting you mentioned that people open up to you. I felt, and I found out after, my mom was really protective of us. So were there things that she didn't want to talk to us about?
Right.
And she actually talked to other people to talk to us about, so that she could make sure that we were okay. So it's a sticky situation. There's a lot of dynamics there.
And that's why every person is different and every family is different. That's why it is really individualized care, because it's so different from one house to the next. To some people are in a nursing home, we see patients, so in assisted living. So every individual has like their own plan. Everyone's going to be different. But it is a common myth that you come on hospice, we stop all your meds, and we just give you morphine. Like, I've
Right.
had
And
many
then that's
people
it.
think that. And that's absolutely not what happens. You can continue taking your medications that you're currently taking. If you were taking an oral chemo pill, that's a curative treatment. So we wouldn't continue taking that. You've decided at that point you don't want to. But if you're taking a medicine to help your heart rhythm, you can continue taking that. I mean, that's comfort. If you develop symptoms like a urinary tract infection, that's painful, and we don't want to have people in pain, so we're treating symptoms. As long as you're able to swallow your pills, we continue taking the medications that you want to take. So we would treat a urinary tract infection, or if someone's having difficulty breathing and coughing, and the nurse goes out and assesses them, and she says, you know what, they seem like they have pneumonia. They'll call the doctor, they give them all the symptoms, and we would treat that. If they're having those types of things, can be really painful, and coughing incessantly is not comfortable. So we're going to treat that for comfort. If you come to a point in time where either you can't swallow, or we feel like the antibiotics are actually going to cause more harm than good, we discuss it with the patient or the family, and maybe we don't treat that. But generally speaking, we give the right care and treatment for a patient at that time that they need. So it's not like a lack of care. We don't stop doing things. We're going to give you what's best for you at that time.
So one of the myths I've heard bantered around is that hospice kills you, or hospice speeds up the death process. But it also seems that a lot of people wait a really long time to decide to go on to hospice. So a lot of people don't get to use the benefit to its full extent.
Yes, unfortunately, that is true. People wait because they are afraid that either they're afraid to talk about death and what that means, that they're afraid to, like you said, they're giving up if they go on hospice. But really, if you are on hospice for a longer period of time before you pass away, we are able to get you more comfortable, and support your family so that they feel more comfortable, and overall people have feel like they are had a much more positive experience if the longer that they've been on hospice before they pass away. So waiting to the last second is, we cannot always get you to the, I mean, we still get you less pain, but it's not going to be as great as it would have been if you had, a couple of weeks or a month or so before, because then everyone will really feel like supportive. You've met everyone on the team, and so the care afterwards. So that's the other thing about hospice is after you pass away, your family still has the support of the hospice team. So like the chaplain still connects with you afterwards, and then at 3 months, and then at 6 months. Like they're always checking in to make sure that you're well supported. You can always reach out if something, anniversaries and holidays and anniversaries of people's passing, those are all really hard days. So they can check in with you afterwards, and we have support groups and things like that. So it doesn't just end at that moment either. So that's why it's good to kind of be able to meet people with a good amount of time before, so that when you, after you pass, you know everyone and you feel comfortable, you can talk to them afterwards too.
That sounds really great. I've mentioned to family and friends when they've gone through an experience after, but I've never heard a silence so strong as, the day after the funeral, right? When everybody else goes back to their normal thing, and now you're just kind of sitting there like, oh, what's next? There's so much commotion that goes into those last few days or months or weeks. If those things are coming, right? Not everybody has that opportunity, but it can feel pretty lonely at that time. So it's nice to know that people are checking in. And we have a hospice night, right, every year. Is that annual?
We do. Yep, we have a memorial mass every year for all the patients that we've had on hospice. So either that year, but also we've had people who've come back year after year. So it's wonderful to see families again. People can bring pictures, mementos, and we put them up on a board in front of the church or the chapel, and it's great just to reflect on that person, but also those families, and it's good to see them again and reconnect.
It's hard not to feel bonded to the people that come and help you out. It's such a personal and intimate situation. I imagine it's a lot of pressure on you to make sure you're doing a good job when you show up to work every day.
Yes. Yes.
You can't really do that at 50% so well.
It is really intense, and it's interesting to me that I find that after having children, it's very similar to the giving birth and that whole team that you have when you're about to give birth, and the whole team that you have when you're passing is very similar. Like, you feel very bonded, and you just went through a very personal process, and so it's just interesting that there's so many things that kind of intertwine the beginning of life and the end of life. So.
Well, if you want other people to feel awkward, let them know that a loved one is passing, right? It can feel so strange. A lot of times you don't know what to say to the person, or what. But I definitely felt that the hospice team got it, right? Like, this isn't your first time down this road. Like, you really understand what's going on. It's not just a Hallmark card or something. It definitely feels deeper, and I will always appreciate those people that came and played with my son, or gave biscuits to the dog and silly things, along with the care and and really the compassion you know, the understanding. You know, there were times where we had to make certain decisions and we felt like we were doing the wrong thing. And those folks that we worked with really helped us through. Like I said earlier, it's nice to have someone kind of hold your hand and guide you through the process who's been there before, you know, even if not personally necessarily every day.
Yeah.
You know, I mean, this is your profession. You are a professional at hospice, so that's rare, and it's a wonderful thing. So I often tell people, you know, working in healthcare is not a job, right? It's kind of a calling. You know, if you're not made for it, it's a terrible experience for everybody. And I feel like the hospice team is kind of set apart from that, right? I mean, you guys are called a little higher than the average person. What do you feel like the strengths of our program really are? What sets us apart?
So our team, our staff is truly amazing. From the nurses to the social worker, the home health aides, they're all just wonderful people, truly caring, compassionate individuals. We have one nurse who we've had for many years, decades, I think, actually, who's been working with us, and she calls them my people. When you know her, she ingratiates you into her life, and her families know they can always call her pretty much anytime, and she will take care of whatever's going on. We have just so many extra supports too for family. In addition to having wonderful people that are guiding them through this process, we have a music program, which is really helpful for patients who have memory diseases to have listen to music from like their teens and their 20s, and you can just see their faces light up. It's amazing. And we actually have a volunteer dog, and he comes in and visits with patients and their families, and we go to nursing homes as well as homes. So we go to a nursing home, there's a certain patient who just, like, literally her face lights up, can't wait to touch the dog, like, loves a dog.
Who doesn't love a dog?
I know. It's just so wonderful to see, though. And if there's anytime we get like new equipment, or maybe a family is having some trouble like transferring someone from a wheelchair to a hospital bed, we have our physical therapy comes in and they kind of teach them that. We have sometimes we have occupational therapy. They help us try and figure out like what utensils would help someone the best. And or we have Barbara, our dietitian, who can come in. She's excellent. Everyone's always afraid. They're either afraid of me or they're afraid of Barbara. They're always afraid I'm going to come in and, talk about the heavy stuff, when I'm transferring someone from palliative care to hospice. And then they're always afraid of Barbara because they think that she's going to take away all their good foods. But she's so excellent, and she just educates people on, what's maybe this texture would work better for that patient, or she has so many excellent tips on just encouraging people if they don't like drinking, like you can have Jello or you can have popsicles. She just has such excellent tips and education to share with families. So
she's a wealth of knowledge.
Definitely, our team is amazing. All the extra supports that we have for our patients, I've never experienced anything like it. And I've had many patients, I think they always think I'm the people's bosses when I come in to visit, and they'll just say, I just have to tell you, but every single person that's come in has been wonderful, and they have nothing but good things to say. So it's great to hear, even though I'm not their boss, but I do share.
Now, you mentioned palliative care. What is that? How is that different?
So palliative care is very similar in philosophy. So we focus on symptom management and making people comfortable. However, you can still go to your physician's appointments, you can still go to the doctors, you can still have physical therapy and occupational therapy. So continue receiving curative treatments, but it's kind of like an extra layer of support in addition to all of that. So generally, I go out to visit with patients and do a consult visit. Sometimes that's all they need. They just wanted me to come out and we kind of talk about things. We fix some symptoms that are going on and we do a MOST form. Or I come back every 2 months, check in, make sure they're not having any trouble breathing or pain or constipation, and I work with their doctors to make them feel more comfortable.
Nice. So it's sort of a transition, almost a first step moving towards hospice.
Yeah, we used to be kind of called a bridge program, but it really is kind of a bridge from, you were seeking, oftentimes you go to the hospital and you come back and you feel better. And then you kind of reach a point in your disease process where even when you're going to the hospital and you come back, you always kind of feel like maybe you're not quite getting back to that baseline of where you used to be. And so it's kind of a different stage in your disease progression. And that's where palliative care can really help support you through that to a point where then we support you through on into hospice. And so then I get to see patients. So I've seen patients that have been on palliative care. I've actually seen them for years. And then I can watch and see, when they're ready for hospice, and then they transfer to hospice and then watch them through that process too. So it's good continuity too, I think, for families to be they know we develop a relationship and they some trust, and they're able to kind of really be able to feel comfortable to talk about things maybe they wouldn't have if they just met me for the first time. So it's very supportive.
Well, it definitely is part of what sets the hospice and palliative care apart, right? Is it's really about the comfort of the person and the whole family, and it can make a big difference in a person's life. So thank you for what you do.
Oh,
and
thank
you for coming in today and talking to us a little bit about the program.
Thank you for having me.
Choices about end of life can be difficult when you're faced with a terminal illness, whether it's your own situation or the life of a loved one. We hope that after today's episode, that whatever you choose, you can do so with confidence and a greater understanding of what hospice is all about. Once we are born, there is only one guarantee. And before a baby comes into this world, we plan a space, we get toys and equipment, and we do everything we can to make sure that that baby comes into this world with all the love and support we can muster. Hospice is very similar. We all know we're going to pass on someday. Have a plan, make a space, and you too can transition surrounded by those you love in a nurturing environment and in a manner that can be not just positive and dignified, but oftentimes beautiful. If you would like more information about our hospice program or any of our services, please give the office a call at 508-992-6278 or visit communitynurse.com. Remember, when it's time to choose a home care provider, choose Community Nurse and we will get you through. And as always, let us know how you liked today's podcast by leaving comments where available. And lastly, please don't forget to follow us on the socials and subscribe to our YouTube channel. Thank you for joining us on Your Care, Your Choice. We hope you'll check out our next episode coming soon, anywhere you download your podcasts. So until next time, let's all try to do a little better together, each and every day.